So in today's video, it's a collaboration between iSchool with Dr. D, that's me, and Warrior Tribe Tactical, my husband. You'll find out some common range injuries that can happen with the eye and what you should do about them. So stay tuned for that. Eye injuries can be incredibly scary, and it's important to triage them correctly to avoid causing further harm when they do occur.
There are a number of eye injuries that often happen whether you're outdoors or at the gun range. It sounds like it's broken up.
And in today's video, we have a special collaboration between iSchool with Dr. D, me, and my husband, an avid
outdoorsman.
My husband, who is an avid outdoorsman with his own firearm training company and range, which is called...
I'm Adam, and I own Warrior Tribe Firearms. No, it's not firearms.
Tactical.
Warrior Tribe Tactical.
We can do this. Okay, I'm Dr. D of iSchool with Dr. D.
And I'm Adam with Warrior Tribe Tactical.
Before we get started, make sure to check out both of our channels, which we will link below. Melanie, me, I post about eye health, eye beauty, and dry eye, while Adam has a channel. What's your channel about?
We do gun stuff, outdoor stuff, survival stuff, all the cool guy stuff. So check us out.
Okay.
Am I going?
You're going.
All right, guys and girls. So we know that out at the range, we're safe. If you're at our classes, safety's first, and you know, finger off trigger, don't point the gun here. You're not going to shoot someone, right? If ran correctly. The thing we worry about, well, I worry about, is that sprawling or wood chips, dirt getting up into someone's eye. And if we can't do a simple wash, what do we do? So that's why I wanted to talk with my wife, who's a really good eye doctor. She knows more than me, so you know, I have some questions about injuries. What else? Eye protection, what's best, and I might throw a trick in there, a trick question at the end. All right, so number one, foreign bodies in the eye.
Yeah, so it's always super important to wear your safety glasses, of course, but even wearing them, a lot of times the patients that I see, they'll say, no, I swear I was wearing safety glasses and I still got metal in my eye, right? So foreign body is anything that gets in your eye that shouldn't be there. That could be metal, a wood chip, to your point, it could be dirt, dust, debris, just about anything from the range. So if you have handy eye wash, and I would recommend that for your range bag, you want to just rinse your eye really, really well. You do want to get down here in the lower cul-de-sac, you want to get up underneath the lid, and really give your eye a great eye wash first. You want to do that for at least 5 to 10 minutes. Often this will kind of help the foreign matter get to the side where you can see it and potentially take it out. Now, an exception would be if you see something embedded in your cornea. I never want you digging at your cornea. If you have metal in the eye, it can rust when it's in contact with your cornea for long enough, so that's definitely something you want an eye doctor to take care of. Now, there are circumstances where you have lots of tiny pieces of metal, and it is possible to use a magnet to get those out. You just want to avoid doing that if there's any potential that the metallic foreign body or metal foreign body is you know, embedded within the ocular tissues.
Sounds fun.
You asked for it.
All right, so we're always using chemicals, lubes, cleaning solutions. Some stuff's pretty toxic for like when you're looking at long range precision guns. What do you do if you get chemicals in your eye?
So there are two types of chemical burns that we see, acidic and basic. So it's really helpful to know if you're dealing with an acid chemical or a base. If you can find out the pH, that's extremely helpful. Acid burns they look a lot worse. So an acid burn is going to make your eye look really red, and like beefy red is kind of what we call it.
I'm beefy.
Yeah, you would know about that. So it's going to get beefy red, right? You know, very, very injected, potentially very painful, versus a basic burn is going to make that eye blanch. Now, acidic burns are actually the least concerning of the two. So they're both concerning, of course, but your acid burns are pretty superficial. You're gonna rinse either one. So very, very important to start rinsing. In my office, if we have someone coming in with a chemical burn in their eye, I kind of have a saying, you know, we do not pass go, don't collect $200. You do not even get really history on that patient. You just start rinsing that eye right away. So whether it's acid or base, number one, rinse it right away. But number two, have your buddy on the range find out, am I dealing with an acid or a base? Because base will go much deeper in the tissue. If you've got blanching of the eye, meaning you can't even see vessels anymore, that's a really bad sign. That means that base has gone very, very deep, and that eye over time won't do as well. So finding out if you have an acid or a base is very important.
Okay. Now, she hit something on the head as far as safety. This isn't eye safety, but a good safety tip. If you can, always possibly shoot with a battle buddy, right? Always take a friend out to the range. It's safer, right? So, penetrating injuries. We always hear about this. You know, and I think this one freaks a lot of people out.
Yeah, for sure. So to talk about this a little bit, when you get into something that could potentially penetrate the eye, you're talking about a higher projectile speed going on, right? So you can have sort of two things happen. It's possible, of course, to have penetration of the eye, which really means get the heck out of there. Don't pull anything out of your eye. Just get to the ER, right? Don't go to an optometrist's office like mine. At that point, you're wanting to go to an ER, potentially call them and let them know what's incoming so that they can get their ophthalmologist on call into the ER, because many ERs do not have their ophthalmologist on site. That's going to be a specialist they call. Now, what's probably more common than an open globe or penetrating injury is a blunt force trauma. And a blunt force trauma can cause all kinds of different eye issues. One that comes to mind is if, for instance, you were start to see a hyphema, which is blood filling the anterior chamber of the eye. So, you know, you would see that where your eye looks green, you're gonna see like red starting to pool. That's a hyphema, and those can occur with blunt force injuries.
So like a scope hit. If you've ever seen someone that's never shot before and they put their eyeball right on that scope, maybe on 300 PRC, kicks back a bit, hits the eye, looks kind of funky.
Yeah, so it does look funky, and it can also cause some major issues with the eye. We see pressure spikes when you have a hyphema occurring. I mean, that's signifying a pretty traumatic event, a lot of inflammation in the eye. And usually my focus would be to make sure we don't have a penetration of the eye, but also to lower the eye pressure and not have a secondary glaucoma situation happen.
So you were talking about eye injury. Now in the Army, we were taught if someone had an eye injury and it was penetrating, we cover both eyes, keep their eyes from moving. Is that something you would suggest?
Yeah, I think that's really, and if you're there alone, you're not going to be able to do that. So all the more
your walking stick.
Yes. Sure.
All right, Dr. Wife of Mine. So the real question that a lot of shooters are gonna want to know is, what can they do about astigmatism with a red dot? Because it's gonna, it bursts, it has a star, does this.
So there's a few reasons why your red dot might not be a perfect round circle, and astigmatism is definitely one of them. As a dry eye specialist, I have to throw in, it could always be dry eye too. So if you're blinking your eyes and it gets better temporarily and then breaks up, that's more consistent with maybe a dry eye diagnosis. If you have astigmatism, you can squint a little bit. That might help sometimes. But really you should look at having visual correction. I mean, you know I'm gonna say that, but you really need to have glasses or contacts that sharpen that up, because for the most part, you're not going to squint out that poor vision.
So there's contacts or glasses that can help stop the burst.
Yeah, so glasses and contacts, there's lots of options to correct astigmatism and give you that sharp, clear, like round target, is it?
It's a little, yeah. I mean, let's face it, not everyone has perfect eyes like I do. So I want to protect my eyes. My beautiful 20/20 eyes. What do you suggest for eye protection?
Yeah, so there's a number of companies that make shooting glasses, which are gonna be up to standard. If you're wearing your own glasses, it's important to find out if they are made of polycarbonate or Triage, because those are really the only safety rated materials. The same if you are, say, gonna wear some Costa sunglasses or Maui Jims. You don't want to wear like a glass Costa at the range because those are not safety rated, but Costa is common, for instance, polycarbonate, and you could wear a sunglass like that and have more protection than if you're wearing your glass Costas that are really for fishing. Those are not appropriate at a range where you need eye protection.
All right, so we went over problems, astigmatism, so there's hope for you guys. And you know what lenses to wear. Do you suggest wraparound glasses, like safety glasses?
I think it's important to find a tight seal sort of fit. We call those a wrap in the business, but like a wrap frame.
In the biz.
Yeah, in the eye biz. I would say a wrap frame is definitely preferred because that is less area for foreign bodies to enter. Thanks guys for joining us for a special collaboration between Warrior Tribe Tactical and myself, Eye School with Dr. D. We hope you learned something. Please leave us some comments down below of future videos or collaborations you might want to see with us too. And that's it for Eye School. I'll see you next time.
Take care.
Okay, bye.